All right, we're recording. So welcome everybody to our first installment here of what we're calling CAPPI Conversations, which is meant to be some informal discussions about addiction recovery, but not only from the words of an academic like myself, but from the words of somebody who's lived it. So I'm Dr. Burel Goodin. I'm a co-director for the UAB Center for Addiction, Pain Prevention, and Intervention, which you'll hear us refer to as CAPPI. And with me today is Mr. Michael Wise. Michael, how are you?
I'm good. Thanks for having me.
Excellent, excellent. So, Michael, what we're really hoping to be able to do here today, for our future viewers is to just have a very kind of, candid conversation about what's going on in your life and how things have been going. What we really hope to be able to do is just minimize stigma, normalize sort of things, help people to know that the road to recovery can be bumpy, but it is attainable, right?
Absolutely.
And hopefully instill some optimism and hope and let people know that there are, supportive recovery options out there. How's that sound?
Yeah, absolutely. That sounds good.
Good. So UAB CAPPI, we're a brand new sort of center. Our mission is really to be able to do a lot of cutting edge research that helps to inform new treatments, but we also want to help educate the public about addiction, chronic pain, how they're related. And why we really believe that's important is because these two disease processes, these two health conditions, right, are often highly stigmatized. And because of that, people can be less forthcoming, less willing to engage in treatment. And that's actually the opposite of what we want people to do, right? So the hope is that having some of these conversations can really help people to sort of realize like, hey, I'm going through that too, or like, I didn't realize that was a thing. I thought I was in that by myself. So again, that's where you come into play here, and you're super important for some real talk. Does that make sense?
Yeah, absolutely.
Great.
So, yeah, really quick, I'll just tell you a little bit about myself. Born and raised here in Birmingham, went to a private Christian high school here in town. My story, I think, is similar to a lot, and then I'm sure dissimilar to a lot of other people, just because addiction and substance abuse disorder affects everyone. It doesn't really, it doesn't pick a favorite. It affects every group, every socioeconomic group, every race, color, creed. But yeah, with that, I'm from here. I didn't really have a whole lot of experience with drugs or alcohol or anything like that growing up. Didn't have really a history of addiction in my family. And I kind of came to just know opioids through sports. I had a couple injuries and, was prescribed painkillers, took those, found out I liked them. It's actually funny. Well, not necessarily funny, but it's interesting. The first time I was ever prescribed a painkiller, I had like tonsils and adenoids removed, right? I was maybe 10 years old. And of course I'm staying home. You get to do that thing when you're a kid and you get your tonsils taken out. So I'm staying home. I'm probably watching Sports Center or Matlock or In the Heat of the Night, whatever. And
cool. All right.
It goes for, I took some medication at 8 and it came 12 o'clock. And I was hollering at my mom. She's staying with me. I was like, Mom, I think it's time for my medication. And she was like, it was like day 3 at that point that I'd been home. She was like, your throat sounds fine. Is your throat still hurting? And I was like, well, my throat never really hurt, but those make my knees feel good. So it's interesting looking back, like even at 10 years old, like I could put together that, oh, I like that. That's a feeling that I really like. And, of course, at 10 years old, like nothing from that ever came. It's not like I started seeking that out, but later on in life, once I was reintroduced to it, I certainly started seeking it out. For me, it kind of progressed into from pills into heroin, and sort of.
Can I ask you a couple of follow-up questions on that?
Yeah, absolutely.
So you described sort of an initial introduction to painkillers through like injury and the need to have something to help kind of curb the pain. Pretty common sort of introduction for a lot of folks, huh?
Yeah, I think so. I think so.
Okay.
Especially for, well, not just athletes, but, I've talked to a lot of people, a lot of my clients now. A lot of times for those who got started with opioids young, it was with sports and it was with, just having so many available in the house, in friends' houses, that kind of thing.
Gotcha. All right. So another question is, um, I hear from a lot of people that they sort of have an initial reaction the first time they maybe take a painkiller medicine of like, ooh, I like that, or like, I didn't like that at all.
Right.
Right? But
Yeah,
it sounds like, perhaps you sort of had that like, that's not so bad.
oh yeah. For me, I mean, it was like, obviously I had the experience when I was 10, but then later on in life, I could remember the first time I sort of took more heavier opiates, and like really feeling for the first time, maybe ever in my life, that like, oh, this is how I'm supposed to feel. Like all of a sudden I've got so much to say. And I was positive that everyone was also so willing to hear it,
I
So,
see. I see.
yeah.
Okay. All right. So that's some of the initial sort of contact that you had,
Mhm.
right, with these opioid painkillers. But later on in life, how did things continue to progress for you?
Yeah, well, of course, things went quite downhill. The negative consequences started stacking up pretty quick, as they do with substance use disorder. Went through a lot of really rough times, not being able to, be around family, failing out of school, not having a place to live, not being able to hold a job,
Hmm.
really running, really affected my social circle, like really, yeah, just affected life in every sense. And so eventually, I get to a point where I want, like internally, I realize I don't want these negative consequences, but then it's like, well, what do I do from here? I don't want the negative consequences, but what's the way out?
Okay. All right. So for you, it was more of an internal sort of revelation of like, I need to change. It wasn't necessarily some grand intervention where all your family members got you in a room and were like, this is what you need to do, Michael. It really had to come from within.
Well, no, like, so I'd been arrested plenty of times, and I had those thoughts of like, okay, I don't like being arrested. I don't enjoy time in jail, that kind of thing. But no, in order for there, like, when real change started happening, it's when I had that, when internally, I realized that like a lot of my displeasure with life was based off of my behaviors related.
Mm-hmm. Gotcha. Okay. All right. And I mentioned earlier a little bit about the stigma sometimes that can come along with, an addiction. A lot of times people just don't really think about it as a health condition or a disease process. They think about it as like some sort of moral failing, right?
Absolutely.
And I guess I was wondering, like, to what extent maybe you had any of those sort of experiences, whether with like friends or family, or even like shame that you were sort of feeling yourself. How about that?
Yeah. So, again, like my background from the South, went to a private Christian high school here.
Okay. Yeah.
Obviously I didn't realize it at the time. But I never really told anyone what was going on with me, and even my own, like, noticing that, okay, this is becoming an issue. This is like an everyday thing. This is a multiple times a day thing. I couldn't tell anyone that, that's not something that, at least the way I was taught to sort of look at mental health in general, it's just not something that I was comfortable telling people. So I wasn't able to like get help in those early stages. I wasn't able to really identify any of those things. And I see that with so many other people. Really, nothing becomes known until things are really going off the rails.
Gotcha. And so that stigma or that uncertainty, maybe some of that shame, really can be a barrier to trying to get out ahead of addiction and get on that recovery road. And maybe delay things until they're really kind of like really problematic. True?
Yeah, absolutely. We just, I don't want to be too general, because I'm sure that plenty of people do a great job of talking about their mental health. But I think as a society, specifically where, where we are. And yeah, we just don't really do that. For instance, like, I think I was telling someone, if I was at the gas station and I was on crutches or had like a walking boot on, and a friend comes in that I hadn't seen in 5 years, and they've been, what you up to today? Oh, well, I twisted my ankle this weekend. I'm just leaving the doctor's office.
Right.
And yeah, I wouldn't have a problem telling anyone that. And I think that's pretty common for a lot of people.
Right.
But however, if I was, if I had just left my therapist's office and someone comes in and say, hey, what you been up to? I think I would have I think the normal thing is for people to be like, they think of something else to say, oh, I'm out, doing something. I was at the dentist or something.
I got you. Yeah. Yeah.
We just stigmatize, getting help for substance use disorder for sure, and just so many other mental health issues.
Interesting. So another kind of component with that analogy you just made there is like, so a walking boot, I can see that, and I'm like, oh, something's wrong with your ankle. What's going on? Versus perhaps, addiction, mental health struggles. People don't necessarily see that. They don't necessarily know how to ask about it. Or if you tell them about that, they may be like, well, that doesn't compute because you look fine.
Right. Yeah. And I think it just goes to like further nail home the stigma.
Yeah.
And, ultimately what I hope with these conversations, here today and going forward, is we can get to a point where we're open and honest about the things that are going on, right? Maybe this conversation can inspire someone to say, you know what, like things are, things are not where I want them to be. Mm-hmm. And it's okay if I own that, because once I own that, I can begin to get help. There's resources out there for me, like CAPPI, like so many other resources in our area.
Yeah, of course. That's great. Okay. Well, let me ask you this, right? When you became ready to sort of really get on that. Sorry, let me ask that again. Here we are in technology.
Yeah, I think we froze for a minute.
We did, yeah. Hey, listen, it happens. Let me try it again. So my question was, when it became apparent to you that something needed to change, right? You needed to kind of get some help for yourself. How did you go about doing that?
Man, I really didn't know at first. I was in a situation where I'd been arrested again. And, thank goodness in Jefferson County, we do have programs. We have diversionary programs where in lieu of, like punitive things like jail time and that kind of thing, our court systems will seek out to link people with treatment. And so luckily for me, I was linked with treatment. Now I'll be honest, like as much as I knew that I didn't want the negative consequences to continue, well, the idea of moving into the behaviors that I needed to do to not have the negative consequences was still somewhat intimidating. A lot of it intimidating,
okay.
Sorry about that.
Hey, no worries, man. This is the world we live in right now, right?
Right. All right.
So yeah, I totally hear what you're saying, right? It's perhaps even knowing in your mind that like, hey, I need this, and still somebody saying this is what you got to do, or else there'll be something even worse. It's still rough to like feel like somebody's making you do something, right?
Yeah, man, it's just an intimidating process, you know, like, but I think eventually with some time to think about it, to process it, the good news is like there are resources available, once I sort of made a decision that, you know what, like, I believe that I can have a better life for myself, then all of a sudden those places that could help became a little bit more evident, right? Like I'm a little bit more willing to seek them out then.
Gotcha.
But it really took sort of kind of establishing, okay, this is not where I want to be. Mm-hmm. This is where I want to be. Now let's figure out the path to that. And then along the path, I sort of realized the places, the resources that could help me out.
Okay. So once you kind of got on that track, that first sort of effort to get to recovery, was it successful the first time?
Oh, absolutely not. No.
All right,
Um,
so it took some multiple attempts, huh?
yeah, it's funny, so obviously now I work in treatment, and I think one of the things that qualified me to do so is I'd been to almost every treatment center in the state.
Okay.
So yeah, no, I started at I think the first time I ever went to treatment, it was on an outpatient basis, but went to plenty of other outpatient treatments, plenty of other inpatient treatments. It wasn't successful the first time in the sense of did I use again following those treatment attempts? I did, yes, but there's several things from those treatment attempts that I think are helpful to me in life to this day. So was it successful in that sense? Absolutely, because I believe some seeds were planted, right? And if nothing else, I knew that, like, so I go to treatment, I continue to use after it, but in my mind at that point, I kind of knew that there was a solution, right?
Yeah.
And once I'd been to a few treatment centers,
Okay.
you kind of pick up on a pattern that there's some similarities between what everyone at these places is saying. And so to me, I was like, okay, there's some validity in that.
Yeah. Yeah. So what a great point. Let's just kind of recap on that for our viewers, because I really think we want to drive this home, right? Is that, it may take multiple attempts to really have that recovery stick, right? And it may be easy for folks to sort of get discouraged after the first or second attempt and feeling like, well, I'm a failure. And now that sort of shame and blame game comes back into play, right? But I think what I hear you saying is that you could perhaps see it as a failure, but it also can be seen as like an integral step for learning, like what's working, what's not working. There's different sort of treatment approaches, and one size doesn't necessarily fit all. So you really got to kind of find maybe what resonates with you. And ultimately, you got to maybe build some momentum until you find something that really works. And you start like 1 day clean, 2 days clean. You really start stringing it together. And maybe, and then you're starting to like really be down that path of recovery. Am I capturing it?
Yeah, absolutely. I think one thing that as treatment professionals, as people who are affected with substance use disorder, as family members who are affected with substance use disorder from, a loved one, I think it's important for us to realize that success in treatment might not look completely linear. Okay. So there sometimes, for instance, those original treatment attempts, I think I learned what not to do. I think I learned more of, okay, that won't work for me. I have to implement this. I have to implement this. I think I made the analogy of it's kind of like if you look at, sort of any big breakthrough, and we'll take like the Wright brothers, right? Like, was every flight before Kitty Hawk a failure? I'm sure the way they wrote it down on those days that they were crashing, they probably said it was. And then I'm sure at Kitty Hawk, they realized, okay, the reason that plane worked is because we learned that this wouldn't work last time and we needed to change this. And I think it's the same way in substance use treatment. So for those people with friends, family members, and for those who are affected by substance use disorder, understand that, like, okay, if you have a track record, or if you're seeing that, okay, there's all these failed treatment attempts, I just don't think that that's going to work for me. Think about the things that you learned during those times. It can still work. We're still working on putting the thing together until it happens. And understand that abstinence, yes, that's the ideal, that's the goal, but it doesn't have to be the only marker of success, right? Like we can learn things to ultimately work towards abstinence along the way to abstinence.
Very wise, my friend. Very wise. I couldn't agree more. And I really like the analogy of the Wright brothers and learning how to fly. I think that's on point. Okay. All right. So I guess now, having kind of been through all this yourself, right? I don't know what your experiences have been. Perhaps you can tell us, like, feeling like, okay, like I've kind of put that behind me, right? Like, using and all the issues therein, but does it ever sort of creep back up? Desires, thoughts, triggers?
Desires, I don't think so. Thoughts, absolutely. I mean, 10 years of my life were spent as an IV user.
Okay.
And with that, it's a complete encompassing lifestyle, right? Like
Okay.
probably saying every waking minute is a little bit of an exaggeration, but it's certainly close to that. So thoughts, yeah, like those are going to happen. I think it's important, at least for me, desires, I would say no.
Okay.
Ultimately, that's because you have to, for me, I needed to learn that there was something worth living for on the other side of that, something that was better than the drugs. And that was actually tough to do because, truth be told, the drugs are effective in that they deliver the feeling that we're looking for, right?
Yeah,
So
great point.
they're reliable in that sense. I needed to believe in a life that was more reliable than that. I would say, as far as like triggers, that kind of thing. Yeah, I will see things. For instance, I'm doing this interview from a room that I overdosed in at one point in my life. I think external stimulus can trigger a thought. Nothing can trigger a behavior other than myself. And I think that's an important distinction.
Yeah. Again, very wise, my friend. Very wise. Okay. All right. Good. Well, I tell you what, we're kind of coming up on the end of time here. We like to kind of keep these videos kind of short and sweet for folks. But one thing I'd like to do real fast is pull up our little CAPPI website. And I'd like to be able to go to our sort of resource page here that's related to addiction recovery options, right? So let me pull this up. All right, now come back to us. Had to become a Zoom sort of pro here, but pro, I don't know. I don't know about all that. Can you see this there, Michael?
There we go.
All right. So yeah, so just, for our viewers here, one of the things we've really done building up the CAPPI website is, things related to what we're about, research efforts, education, development, community outreach, and this is patient care, all right? And this is UAB substance use treatment services like Beacon Recovery, right? Addiction recovery at UAB, but then also we got community treatment resources. There's hopefully some good information out here as well as just other resources, right? So not to just plug UAB because I don't want to come across as too biased, but here's like our various community sort of treatment resources, right? Got a whole host of things here, right? Treatment referrals, residential treatment for men and women, residential treatment for pregnant women, women with children, residential rehab, opioid replacement, all kinds of things here. So the point just being, and thank you for bearing with me here, is that for our viewers, right, there's a lot of options out there, right? And folks like Michael, are very, very good sort of liaisons to getting hooked up to these treatment options. And that's also what we want CAPPI and our affiliated folks to be as well, right? Is liaisons and sources of support for addiction recovery efforts. So just want to put that out there for our viewers. I'll stop sharing now, right? Any last thoughts, Michael, before we wrap up?
Yeah, if I could leave, I guess, any of the viewers with just a few thoughts. Again, just like touching back on the stigma and the idea that substance use disorder is a moral failing. I think that's one area that we really kind of almost make it more difficult for someone who's still suffering to actually get that help. Because I promise you, anyone that who's been down that road, no one would sign up for that life. It's not a fun life. Now there might be some things said and that kind of thing to sort of to almost protect that behavior, because again, changing it is an intimidating process. Our identity does not like the idea of change. That's just our identity does not like
change
that.
Is hard. Indeed.
Yeah, that's across the board. But it's not a moral failing. It's really not. it's a disease, and whether you believe that or not, the Surgeon General of the United States says it's a disease, and we can think of it sort of the same way we look at diabetes. It's a disease that's brought about maybe by some poor behaviors, but once it gets to that point, it truly resembles a disease model.
Right.
I think with that, there's still plenty of things that we can do to help. If that's someone who, if you know a loved one who's suffering, or if you're suffering yourself, there's still hope. Hope is absolutely available. I see, all the time in my work, and I'm fortunate to be able to experience in my life, like hope is available. Change is absolutely possible. And if you've attempted it many times, maybe, been trying to get clean for a decade, don't give up. There are resources out there that are willing to help you, and you don't ever run out of time until you run out of time. So if you got time, you're listening to this and you want change, look at those resources that are available on the CAPPI page, and know that it's still available for you.
It's great. It's great. Said like a professional. I like it.
Right
Okay.
on.
All right. Great. Well, so I tell you what, let's go ahead and wrap up here then, and I'll stop the recording. Michael, a pleasure. Really, really appreciate your willingness to kind of put your story out there, and I really feel like it'll resonate and help out a lot of folks in the future. So thank you for that.
Absolutely. Glad to do it.
You got it. All right. Take care now.
All right. Thanks, guys.
Yep.